Singapore healthcare providers are bracing for a wave of travellers wanting pre-departure COVID-19 PCR tests in the coming months as China loosens border measures. This as Chinese citizens are also set to return for New Year festivities. Already, at least one chain of clinics has seen demand spike by around 20%. Sherlyn Seah tells us more.
1, 2, 3, 4, 5. Feeling okay?
Each week, UniHealth does about 100 to 150 swabs for polymerase chain reaction or PCR COVID-19 tests across its 4 clinics. In the past month, more have been coming forward for pre-departure testing, mostly among Chinese nationals returning home.
We do see a small spike in COVID-19 demand, ranging from about 15 to 20% increase since the mid of November. And yes, we do attribute this small increase to travellers going to China as well, because China has recently shifted its COVID-19 zero tolerance approach to living with COVID-19. It is easier to travel to China.
Since mid-November, inbound travellers are required to take just one PCR test within 48 hours before travelling to China instead of the previously required 2 tests. Just recently, in early December, China had also eased significant COVID-19 curbs, including allowing those infected to isolate at home instead of being taken to the hospital, as well as the lifting of restrictions of entry into public spaces. UniHealth is now gearing up for a further demand spike in January, with people travelling for Chinese New Year celebrations. It's the same for Raffles Medical that predicts an upcoming surge. Right now, it does around 150 to 200 swabs each day across its 40 clinics.
We are preparing ourselves to meet a surge of at least 30-50% over time. The PCR side, no issue because our capacity can meet even up to 100%, 200% surge. So the supply itself is not an issue. So when the requirement is needed, our operation, our provision of service can even extend to a 24/7 type of service for this group of patients.
Meanwhile, for Healthway Medical, the group of 50 clinics says it has enough manpower and capacity to cope with rising PCR testing demand in the coming months.